Last week, we discussed the dangerous health risk astronauts face, called spaceflight-associated neuroocular syndrome, or SANS. And though not much is known about this threat, Dr. Joshua Ong, a space medicine researcher, revealed the leading theory is that an imbalance of fluid inside the astronaut's body causes increased pressure within the skull. Unfortunately, this theory is hard to prove in space. When a normal patient on Earth is experiencing intracranial pressure, it's often measured using a lumbar puncture, a procedure that's not happening on a spacecraft. And while there's current research working to create a non-invasive option, they don't know for certain that it's the correct underlying cause. Ong says another thought is that the astronauts' brains could be lifting slightly during the missions and creating a strain on the eyes.
So if the brain goes upward just a tad bit, it will pull on the optic nerve and essentially flatten the globe of the optic nerve, which is also one part of SANS, which is one of the findings of SANS. So ultimately, the thought is that the etiology of these kind of interesting constellation of findings in these astronauts is multifactorial. It could be partially increased intracranial pressure. We don't know for sure if they have a high intracranial pressure, but also could be a mechanical component of the brain being like kind of shifting upwards as well.
While SANS doesn't usually occur during short trips, it's a dangerous risk for missions that take 6 months or longer. And with the mission to Mars that's expected to happen in the next decade or two, this research will be pivotal in the success of that undertaking. The first few steps scientists have taken are putting machine learning technology on the International Space Station so that astronauts can record their health status while in deep space. Additionally, part of their research has discovered that some people may be more genetically predisposed to being at high risk for SANS. This knowledge could help NASA vet the proper astronauts for a longer mission.
Who is going to be the least at risk for this? Because ultimately, the worst thing would be for astronauts to go blind on a very long duration space flights. That would be catastrophic, especially if we're going to Mars and doing a colonization mission and they go blind. That's just a very, very unfortunate outcome for the astronaut themselves and also for the team and the safety of the team as well.
Along with looking at the genetic predisposition of prospective astronauts, Ong says vitamins can play an important role in a person's risk.
If you're deficient in certain vitamins, you have an increased risk of getting SANS. So they're looking into using vitamin supplementation, such as like B vitamins specifically.
If the health reports of astronauts in space start to show signs of SANS, they may be able to halt the symptoms by increasing the certain vitamins the astronaut is deficient in. This eye imaging technology is part of NASA's effort to get more health equipment in space.
So things such as something called an optical coherence tomography, and also like orbital ultrasound, where we kind of look at the eye itself through an ultrasound. And so those technologies allow us to understand a little bit more and help us characterize what we know now as SANS.
Much of this technology utilizes AI. For example, the optical coherence tomography takes pictures of the back of the eye, then uses AI to analyze the image and help diagnose any issues.
There are a few ways that we are using artificial intelligence for SANS, but I think the biggest thing is basically detecting if an astronaut has SANS. And so that's really helpful because they can be subtle. And so astronauts can get scans, but these scans are very, very high quality. And especially if we're looking at a long duration spaceflight mission that's moving away from Mars, that increases the technical load and the capacity to send those high quality images back to Earth to Mission Control Center. So we want to be able to have something in-house in the space station that can automatically detect if they're having SANS.
And this technology won't just be valuable in space. Ong is also excited for people on Earth to use this equipment to catch the early signs of optical nerve swelling.
Really passionate about also leveraging some of these technologies, some of these novel technologies that we have that we're developing for the space station, and also bringing them back to Earth to really help a lot of the patients, the most marginalized patients. And that's initially what brought me into medicine in the first place, working with patients that were uninsured, didn't have insurance, and they didn't have really good access to care due to barriers. And I think that a lot of the things that we're working on now to address the kind of limited, resource-limited environment in spaceflight can also be applied for our most underserved patients as well.
Ong, who serves as the editor-in-chief for the Journal of Medical Artificial Intelligence, believes AI will be able to address the barriers to care many patients experience every day.
One of the things that really affects one of the technologies and imaging technologies that's really important for patients here on Earth, and also we believe for astronauts as well, is something called a fluorescein angiography. And that is essentially an invasive procedure where you have to put dye into the arm. And essentially, you put the dye into the arm and then you take pictures of the eye itself. And you kind of see how the blood essentially permeates throughout the eye.
While it's a great option for patients on Earth, it's never been done in space, and for good reason.
The dye can cause allergic reactions or anaphylactic shock in very, very rare cases, and that would just not be great. Second of all, putting a needle into and breaking skin while in space is much more complicated than doing on Earth. If something were to go wrong, we just have limited medical capabilities. So it's never been done before, but it can provide a wealth of information for astronauts, and it provides a wealth of information for patients on Earth. But it's also difficult to access as a patient on Earth.
In an effort to bypass this barrier, Ong's been working on using generative artificial intelligence to create the same image as the dye injection, just without any need to break skin.
It's still ongoing work, but I think that the first thing is that it will provide a lot of new information about the vasculature of the eye for astronauts and for us to understand a little bit more about how they're dealing with space, because they do have access to this non-invasive image modality, which just takes, it's the fundus camera that just takes just an image of the eye. And if we can use generative AI to essentially create those synthetic angiograms or the fluorescein angiography, then that'll be excellent. And for patients with diabetes, diabetes can affect your vision. And unfortunately, many Americans and many people across the world have diabetes. And using that fluorescein angiography is really incredible to provide a wealth of information as to, how can we treat, where are the areas that your eye is not getting blood.
Ong believes this technology will not only increase detection of eye issues, but help expand access to these options that are often only available through a specialist.
A lot of patients, especially those in underserved communities and marginalized communities, don't have access to that, and also don't really always have access to a retina specialist or someone that can really treat and diagnose that. But they might have access to maybe an optometrist that has a fundus camera. And so we can utilize that technology to basically create that gold standard image to understand the areas of non-perfusion or areas of where, maybe the diabetes is affecting your eye, and send that to a retina specialist. Then that can really increase the accessibility, being like, okay, only maybe 100 patients can see one retina specialist a day in that general area, but there are 10 optometrists in the area, and they can see, 100 patients as well. We don't know if they're at high risk, and they can all do the kind of generative AI technology. Then we have essentially 1,000 patients being funneled to the retina specialist, and they can basically say like, hey, these are the people at high risk. They're at high risk for losing their vision in the next 6 months. They should come see me right away.
This technology bridge helps ensure that as we make further progress into space exploration, the life still on Earth isn't left behind. You can find more information about Dr. Joshua Ong and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.